Hi, I'm Wendy. I'm standing in one of our ICU patient rooms here at IU Health Arnett Hospital. Allison is with me, our interim chief nursing officer, and she's going to tell you about some incredible things happening here at our hospital.
Hi, I'm Allison. We're really excited to welcome you today to IU Health Arnett Hospital and to showcase our amazing team and all of the amazing opportunities that we have for nursing professional development. Indiana University Health Arnett is a 191-bed magnet designated hospital. We have a level 3 trauma and emergency department. We've got a 14-bed ICU. We have acuity adaptable units that are both progressive care and med-surg components mixed in the mix to help you develop your nursing development skills. We also have a pediatric unit, a level 3 neonatal intensive care, and level 3 perinatal standards obstetrical unit. What is really awesome about IU Health Arnett Hospital is the people and the leadership here. What I'm most excited about is on our transformational journey to develop empowerment with our nursing team members to use innovation and best practices to truly develop awesome outcomes for our patients. All of these characteristics together truly exemplify a magnet nurse, and that is what we're hoping to accomplish with your professional development here at IU Health Arnett Hospital. Enjoy the rest of your tour.
Next, I'd like to interview Audrey from Central Education. She helps with onboarding new nurses. Audrey, what can you tell us about your role?
Hi, I'm Audrey. The first thing we do after you get hired on is we go through a process called Core Week. This is a general education. It's a week long. You're going to get to go out to the units, meet your new managers, your educators, and kind of get used to your unit. The week after that, we do a program called Foundations. This is a really hands-on, neat experience we have available to new nurses. You're going to learn in class, hands-on in the unit, and play around with our Sims mannequin. During this week, you'll get to follow teams like respiratory and wound care, and then you'll have guest presenters from Dietary, American Heart Association, and the AA. This is really a crash course to get used to all the equipment and the different things you'll see on the unit. It's a jump start to your journey to excellence with IU Arnett. Speaking of mannequins, let me introduce you to Charlie Arnett. She's an awesome tool we recently acquired. With her, we can listen to lung sounds, heart sounds, get practice checking pulses. She can really do it all. You won't just see her in Foundations, however. You'll see her out on the unit practicing mock codes.
Thank you, Audrey. That's so wonderful. How do you offer support for our new nurses throughout their first year of practice?
I'm glad you asked, Wendy. Here at IU Arnett, we have an awesome program called Transition to Practice. It's a series of learning and support designed to help transition our new nurses. The purpose is to empower new nurses with tools to lead to success as a direct care nurse and to enhance their development towards a competent stage of practice. We understand that your first year as a nurse can definitely be a roller coaster, and we're here to help. Just another way we show compassion. Cohorts will participate in learning connections for educational support, skills acquisition, development of socialization skills. We'll focus on communication skills, protocol, and professional development in this class. What's really cool is we bring in speakers from all around the hospital. There'll be people for evidence-based practice, risk management to help you with charting. We have the diabetes education, and even palliative care comes in the mix. A little breakdown of some of the classes. The third class is really neat. We do a celebration class where your managers and educators will come in and say some great words about how your journey has gone thus far. The last class is your sixth class, and what we do is you guys get to choose what speaker you want to have come. I've had representatives from Lifeline come in, and they bring in the helicopters and the mega ambulances, and you get to crawl around it. It's a really neat experience. We've also had the therapy dogs come in, which everybody loves to cuddle with the animals. And then we've had other nurse practitioners come, which is really cool to learn about their journey and ways you can develop your career as well. The best thing I think about transition to practice, though, is it's the bond you build with your fellow nurses. So in your class, you're going to have nurses from all different units, and it's a really good way to get to know nurses from other parts of the hospital and experience what they're going through. It's a way to see that you're really not alone in your first year journey, and we're all a big team here at Arnett.
Thanks, Audrey. We have a nurse that just finished transition to practice that Audrey was telling us about. She's going to give us her perspective on how that was.
Transition to practice for me was an honest place to talk about our insecurities, our fears, and also our successes about nurses as we came into this program. It was established early on that the purpose of this group was to teach us the tips and tricks of becoming a nurse and the things that we wish we would have known when we started as nurses. There's no secret, there's a clear gap between nursing school and taking care of patients and their well-being. The purpose of transition to practice was to be able to bridge that gap and have a trial run of the disparities of, we're new to this, how can we be successful? For instance, we are provided with small group tutoring sessions for DKA patients, catheterization patients, end-of-life care, and wound care. And we learned the common mistakes and also the common treatments and what we should expect with these patients, which I value most because I am in progressive care and deal with a lot of cardiac and pulmonary patients. So it was important for me to build upon that acuity and know exactly what was expected of me. Transition practice was also very fluid. It took shape of what we really needed. There was a lot of progressive care nurses as well as ICU nurses, so we built on that acuity. Every meeting we were asked what we were looking for. It was catered to us. So if we wanted to know more, for instance, about wound care, we had touched about it, but so they brought in the nurse specialist for wound care. But you're expected to learn a lot. It's a lot, it's heavy, and transition practice also created a network accountability for us. You learn a lot in orientation, but this was a safe place to say, I don't know, and be with other people that didn't know.
Innovative, creative, out-of-the-box thinking. These are just a few of the words that we could use to describe our Med-Surg to ICU RN fast track role. What is this role, do you ask? I'll tell you. A nurse is hired on to the 6th floor, our Med-Surg floor, where they are trained as a Med-Surg nurse and progress to a PCU nurse, all the time collaborating with ICU, getting education, shadowing an ICU nurse. After they have met certain milestones and they are doing well in their practice, after a certain amount of months or a year or more, then they could be considered for the next open position in ICU. Now I brought a few friends with me here today to explain this role even further. I have my friend Melissa, the manager of the ICU, and my other friend Danny, the manager of AC6 here with me. I have a few questions. Melissa, as the manager of the ICU, why would you be interested in working with the Med-Surg for such a role?
I wanted to explore ideas and how I could invest in the nurses here at Arnett Hospital. I wanted to figure out a way to help their growth and their development, to support all the team members in that transition from the Med-Surg world to the ICU world.
That's great, Melissa. Thank you. Danny, as the manager of AC6, how does this RN role benefit your unit as well?
Well, Brittany, the educator on AC6, and I think this is an amazing opportunity to recruit nurses and help grow them in their nursing practice, while keeping in mind their ultimate goal to get to the ICU and become that expert skilled nurse.
Thanks, Danny. I am here now with my amazing friend Elizabeth, one of our first-year nurses here in the ICU. Elizabeth, would you mind telling me how it is that you felt supported by the hospital during your first year?
One of the things that I think is unique to Arnett Hospital that I don't think a lot of other hospitals do is that we have a program called Transition to Practice, and that's a program that meets every 6 weeks, and it's all the new grads that start at the exact same time. So that was a really good time to come together and talk about our experiences as a first-year nurse, some of our shared successes and challenges that we both had. So it was really good to know that there were people there with you that were going through the same thing that you were. And then also it was just kind of nice to see some familiar faces at the hospital through that first year that you knew from transition to practice because you started at the same time.
So glad that program was helpful for you. My next question for you is can you tell me a little bit about how your orientation was here in the ICU, how you felt supported during that?
My orientation in the ICU was pretty extensive. It was 9 weeks on days and 3 weeks on nights. And during that time, I got to precept with some of the most experienced nurses that our unit has. So that really made me feel supported. After my orientation was over, I never really felt like I was truly cut loose. I always had my charge nurses and a lot of other staff nurses to help me. It's amazing the type of questions that you think of that you may have not thought of before. Just someone to go to and say, like, am I doing this right? Or is there anything I could do better about this? Or is this normal? So I always really felt like I had the support of my charge nurses especially. So that was really helpful.
That's so great. Elizabeth, my last question for you is this. Is there one other thing that you would like us to know about your first year being a nurse?
I think you really need to advocate for yourself and know that you probably know more than you do, but also just give yourself a little grace because you know you're going to make mistakes. I wanted to challenge myself in my first year being a nurse because I knew my orientation was really extensive. I knew that there was a lot more to learn about being an ICU nurse. So when I hit my 9-month mark, I actually met the hour requirement to take my CCRN exam. And so I studied for that for quite a bit of time. And it was during that time that I got a lot of support from my charge nurses and my staff nurses during that time. It was a pretty tough exam, a lot of content to study, and I had a lot of questions for them, things that I may have not seen before or I just don't see all the time here in the ICU. So that was a lot of studying that went into that, and so I really don't think I would have been able to do that without the help of some of my nurses on that unit. So I would say definitely advocate for yourself and push yourself because the learning never really ends in the ICU.
Elizabeth, that's some great advice. We're so glad that you're on our team. So I'm down here in the emergency department now with my friends, and they're going to talk to you about all the incredible work they're doing down here.
Hi, I'm Amanda Reardon. I'm the Emergency Department and Trauma Clinical Operations Manager. And here in our emergency department, we are a level 3 trauma center, which means that we can take any patient, any injured patient, we can get them stabilized and we can treat them. If we can't provide continuous treatment here, we do have plans to send them to a higher level of care, but we can't stabilize and treat anyone. Being a level 3 trauma center means that with our sickest patients, we have a trauma surgeon here at the bedside within 30 minutes. We also provide an amazing service to our community by having SANE nurses or sexual assault nurse examiners, and they are able to help with forensic exams and give support to our patients and to our staff as well. We are also a stroke certified center, and we are a chest pain center, so we do lots of great work with all of our patients for the community.
And I'm Brittany Wither, I'm the Emergency Department Director. I'm really excited about all of the work that we've been doing here at IU Health Arnett to ensure that we can make that transition from the novice nurse role and that thinking into a competent and highly skilled emergency department nurse. We've built in programs in our educational onboarding that allow for an individualized approach to make sure that you're prepared when you come off orientation and can feel supported in that first year of transition and beyond. We work really hard as a team to make sure that any team member and patient that comes in our department not only feels supported to provide excellent care, but that patients are receiving that same level of excellence. We hope that you'll come and join us here at IU Health Arnett and learn all the great things and great ways that we take care of patients.
We can't wait for you to join our team and become a magnet nurse. We'll see you soon.
Bye.
Bye.
Bye-bye.